Welcome to Training Module 1, an overview of traumatic brain injury. During this short training, you will learn what a traumatic brain injury is, the different types, and who is at risk. So what is a traumatic brain injury? Traumatic brain injury, also known as a TBI, has been described in many ways. The Center for Disease Control and Prevention describes a traumatic brain injury as a disruption in the normal activity of the brain that can be caused by a bump or blow to the head. There are two types of traumatic brain injuries, open head injury and closed head injury. An open head injury occurs when there is an open wound to the head. This open wound can be caused by an unfamiliar object such as a bullet. Damage may be caused to the brain tissue that is surrounded by the object. A closed head injury occurs when there is damage to the brain without any internal wound to the head. There may not be damage that you can see to the skull or surrounding structures, but the brain has experienced damage. An example of this would be a concussion while participating in a sport, such as football. There are several known causes that may result in a traumatic brain injury. Falls are the number one cause. In 2013, they made up 47% of all TBI-related ER visits and deaths in the United States. Also, there are car accidents, violent assaults, intimate partner violence, also called domestic violence, being hit by an object, sports injuries such as concussions, and military injuries such as explosions. After receiving a traumatic brain injury, the brain often has complications due to damage. Some of these signs and symptoms include physical problems such as headaches, dizziness, vomiting, seizures, loss of consciousness, etc. Sensory problems, such as increased sensitivity to light, touch, and sounds. Behavioral changes, such as anxiety, depression, anger, and mood swings. Problem with thinking skills, such as solving problems, attention, memory, and planning. Speech and language problems, such as muscle weakness, causing speech to become slurred, problems understanding others when they speak, spelling and writing, and social communication issues such as following rules, understanding jokes, difficulty with gestures, or inappropriate body language. So, who can help? Multiple professions play a role in the diagnosis and treatment of a traumatic brain injury. This is not a complete list of all the professionals that someone with a traumatic brain injury would see, but some of the professionals include a neurologist. A neurologist can help in the diagnosis of a TBI by looking at the symptoms. However, a mild traumatic brain injury will not usually show up on a CT or an MRI scan. Also, a neuropsychiatrist or a neuropsychologist. These professionals can help an individual with a TBI by testing thinking skills, behavior, and emotions, and doing a complete evaluation to see what's important for creating the plan of care for the patient's goals. Also, an occupational therapist. They work with a patient to seek the highest level of functioning with daily activities such as bathing and dressing. A physical therapist, and they help in addressing the physical aspects a person with a brain injury might have difficulty performing. And a speech-language pathologist. They can assist in understanding speech, expressing oneself when communicating, assessing thinking skills such as memory, attention, and planning. And they also can provide a communication device for individuals who have severe injuries and cannot speak. Everyone is at risk for a TBI. However, there are certain populations that are at an increased risk for a brain injury. Children, newborn to 4 years, this is due to falls. Older adults, 60 and older, this is also due to falls. Males at any age, due to being more likely to engage in risky behaviors. Young adults, ages 15 to 24, also due to risky behaviors and motor vehicle accidents. Provided below are additional resources that you may find more information about traumatic brain injury. You have now completed Module 1. This module was designed to give you an overview of traumatic brain injury and its many areas. Now you will begin Module 2. This module will provide education on traumatic brain injury and intimate partner violence. You will be shown a traumatic brain injury screener and instructed on how to give the screening tool.